The Caribbean is famed for its beauty and diversity. For many, it's heaven on earth. But when the weather takes a turn for the worse, this heaven can quickly become hell.
We need to ensure that our facilities are resilient to any kind of natural or man-made disasters so that they can continue to provide the services whether we have any major disasters or not.
An estimated 70% of healthcare facilities in the Caribbean and Latin America are located in areas prone to damage from natural disasters.
The Safe Hospital Initiative is very important, especially for our developing countries. Initially, hospitals were developed to provide medical responses to persons who would request those services. No emphasis was placed on the hospital itself being able to withstand or endure the impact of a hazard. So whereas we were preparing for the external clients, we were not preparing for the internal clients to mean the staff and the patients who are already warded, as well as the equipment and facilities to ensure at that time, if we were impacted upon, we'll still be able to provide the service. So with the coming in of the Safe Hospital Initiative, it really made us become aware of a different dimension of preparations. The first assessment was done at the Grenada General Hospital in March of 2008. After that assessment, a development plan, a safety improvement plan was developed. We looked at some of the priority areas where we were very weak. In recognizing those shortcomings, we embarked upon some improvement measures. One of the major improvement measures we embarked upon was to ensure that we have a ready supply of oxygen. In the past, we were receiving oxygen from our local suppliers, as well as a backup from IJL in Trinidad. But what we have found out is that there were times when we had tremendous delays, when we had to use the Coast Guard to actually come in to bring in oxygen first. So one of our priority projects was to ensure that we install our own oxygen generating plant. In so doing, it gave us the assurance of having a ready supply of oxygen. So this was a major achievement.
As part of their commitment to safe hospitals, the Pan American Health Organization and the World Health Organization have implemented the project Caribbean Health Services Resilient to Emergencies and Disasters. Funded by the European Union Humanitarian Aid and Civil Protection, this project aims to strengthen health services capacity in St. Lucia, Grenada, and 5 other countries so they can adequately respond to patient needs during emergencies and disasters.
That initiative was adopted by the government of St. Lucia to make all our hospitals safe. We carried out an evaluation of all the facilities in the island to see the level of safety that the facilities were at. One of our most vulnerable facilities was found to be Soufriere.
Our hospital is a very old hospital. It is in a flood-prone zone because of the hurricanes, and usually during a hurricane it is usually cut off from the north of the island.
We took the initiative to renovate this hospital and ensure that it was able to survive in any disaster so that it can provide for the needs of the people in the area. PAHO came in to assist us in that initiative, and we've worked diligently to get that hospital to a level of safety to make it a safe hospital.
One of the highlights was our simulation exercise that we had, our disaster simulation exercise, where we simulated an explosion at one end of the building. And it actually showed us where we needed to improve upon and the flaws that were there. So it actually gave us an insight into how we could manage better if we had a disaster such as an explosion.
When the Safe Hospital Initiative came about, it was something that we embraced, and we actually want to continue, and we ensure that all our facilities were on board with this initiative.
There is more work to be completed in St. Lucia and Grenada in order to achieve the aims set by the Safe Hospitals Initiative. But most importantly, significant progress has been made.
I want to place on record our gratitude to PAHO for the wonderful work that they are doing, not only here in Grenada, but throughout the region.
In its entirety, the following include upgrades and operational protocols that are part of the Safe Hospital Initiative: disaster simulations and training exercises, safety procedures for oxygen tank storage, installation of fire extinguishers, smoke detectors, air conditioning units, and backup freshwater reserve tanks.
Achieving that level, saying that we would finally have a safe hospital, at least for one of our smaller vulnerable hospitals from our study, was a good achievement.
The plans developed through this project can serve as guidelines that regional stakeholders can replicate in their respective countries, helping to preserve this piece of heaven on earth.